The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You, and I'm your host, Bob Roth. And if you are just tuning in, we're a show about how our older adult population can live a healthier, happier life, and we come at you live every Friday. Coming up on 8 years, we've done probably about 400 programs, and if you want to catch some of our previous ones, go up to our website at cypresshomecare.com. Click on the media button, and we are the third button down radio show, and you can catch all of those shows, and this one today. And if you've heard our show before, you know our show is not about me. It's about the guests that we bring to the show, and today is no different. I am really pleased to have here in the studio with me Rocco. She is the market director for Dispatch Health. And if you don't know who Dispatch Health is, you better listen in here today. These guys are phenomenal. They are amazing. So let's just get this party started. Rebecca, welcome.
Thanks, Bob.
It's
Great to be here.
It's so good to have you here on the show. And certainly, you know, Dispatch Health is a new concept. And you've been here just for a couple years.
Well, 3 years, yes.
3 years.
We're 5 years old as a corporation, yes. 3 years here in Phoenix.
So
very new.
So as you're talking about very new and Dispatch Health, what is Dispatch Health?
So we are a mobile acute care provider. So in real terms, that means we are a mobile urgent care provider. So we bring about 70% of the ER with us, and we provide care right there on scene. So we've kind of perfected it. It's an amazing concept, and we're kind of urgent care on steroids with just that little piece of the ER.
Wow, it really is amazing. And you know, for a home care agency like ours, we have actually relied on Dispatch Health. It's been a really nice service offering that we can offer our older adults who, you know, for them to, you know, our older adult clients, and that's the majority of who we're serving, for them to go into an urgent care or an ER, it's really a difficult process.
They're frightened. And we actually, we see people all through the spectrum of life, so ages 3 months all the way to the end of life, palliative care and hospice. So it's a pretty unique concept, and it's been well received here. Most certainly because our services are covered under insurance. So it's typically the cost of an urgent care copay, so it makes it very convenient to use.
Wow, I didn't even realize you did children.
Yes, we do.
That's incredible. And especially now with COVID, I would imagine that
yes.
The phone must be ringing off
It
the
is,
hook.
and we are treating and testing for COVID as well. So we don't have rapid tests, but our response time is about 2 days right now. So we're able to test right there on scene, especially for our older population. You know, I think they're feeling a little unsafe about going out into the world and feeling a little vulnerable. So we're able to see them right where they are.
Well, and you mentioned right where they are.
Right where they are.
And that's the biggest challenge we have in healthcare today is that many healthcare practitioners don't know what and how people are living.
Right, exactly.
And a lot of times the health challenges that they're dealing with are a result of their living situations.
Yes. So we spend on average 50 minutes on scene with our patients. So we're able to look at their environment. We do what's called a social determinants of health. So we're looking at things like, do they have enough food in their pantry? Are they taking their medications?
Wow.
Is their environment safe? Are they at fall risk? Are there other safety concerns within their environment? So those are all things that what we can do is bring resources in to help those people that may be more vulnerable.
That is amazing.
It is
I
amazing.
I don't even think I realized you did all that, because
Yes.
that's some of the work that we do. And,
Right.
and for a home care agency like us to have you go in ahead of time and really kind of survey the resident and the client that we may be taking on, you've already done that, and you may even be able to influence and help us in developing a care plan.
Yeah, and absolutely. We use advanced practitioners. So they are nurse practitioners or physician's assistants. So they are practicing at the top of their scope, just like they would in any other primary care, urgent care, ER environment. We are not primary care. We are urgent care. So we don't want our patients to use us as primary care. We want them to stay with their primary care physician. But our advanced practitioners always come as a team with a dispatch health trained EMT. So there's always a team of 2 in the vehicle, and we have an ER physician who has oversight in this market on a daily basis. So if someone says, I want to talk to a doctor, we can certainly get them on a phone with a doctor. And that's not telemedicine. I mean, we are right there on scene, eyes on the patient.
Well, I love the fact that you've got not just one person, one practitioner
Yes.
coming in. You've got 2,
2.
and
Yes.
and that would give me a lot of comfort knowing that, hey, you know what, I've got professionals coming in,
Yep.
and then also from a security standpoint, you've got 2 people that are going into a home, because you never know what you're going to get into.
We never know. And we could be seeing a 3-year-old and then go right into a senior living facility from there, and then go up into a mansion. It's every day is different. It's such a rewarding thing to do.
It has to be.
It really is. It really is.
I mean, you said 3 years in the market,
3 years.
5 years since inception.
Right. So we were started by an ER physician, Dr. Mark Prather, who is still at the helm as our CEO. We were actually started as a pilot with Centura Health and Denver EMS. So kind of came out of that EMS system.
Mm-hmm.
They realized that there was a need for acute care on site, trying to get rid of some of that 911, those useless 911 calls that are unnecessary, right? And so Dr. Prather actually rode along with the EMS for 18 months, and out of that came Dispatch Health as a company. So we work very closely here in Phoenix with Surprise Fire. So they will triage with us on the ground. And EMS is going through a reimbursement strategy called ET3 now. So we're looking toward a lot more partnerships with EMS around Maricopa County.
It makes so much sense.
It does. Because, people really, it's a habit to call 911. It's especially for our senior population, it's just a habit. And what we try to do is educate, about, when is it appropriate to call 911? If I remember talking to a fire captain down in Sun Lakes, and he said, I had someone call me because they had an eyelash stuck in their eye, right? So it's these visits that, you're pulling a truck up with, and you've got 4 or 5, paramedics and all of the staff that are required on this truck to go out to do something like that. So it's, we really want our first responders to be there for real, true emergencies.
I am fascinated by people like Dr. Prather.
Yes, he's amazing. He's a visionary.
He is. And I have a friend of mine who's been on the show, Dr. Alan Roga. I don't know if you know him.
No.
He was an ER physician, and he too saw there were people coming in that didn't need to be in the ER, and he created a company called StatDoc, which he ended up selling to Teladoc.
Yes.
So it was all, the using devices and having visits. And Dr. Prather's taken it a little bit further in the sense that you're doing physical visits.
Right.
And I would say that doctors sometimes who are trying to do things virtually say, hey, you know what? I need to get my hands on this person to really understand what they're dealing with.
Right. And I think telehealth works for a segment of our population, but our seniors are so vulnerable. I think having hands-on and spending time in their environment is so important.
Especially the environment.
The environment is so important.
So
important.
So I looked up a couple things prior to our show.
Okay.
And
Don't surprise me.
and I saw Dr. Prather do a blog for Medium.
Yes.
And didn't know Dr. Bruce Leff was an advisor.
Yes, he is one of his mentors.
Johns Hopkins,
Yes,
and
yes.
he does a little bit of work for
Right.
the company I work with, and that's Honor Technology.
Yes, he spoke at our last corporate symposium. He's quite a unique gentleman.
He certainly is.
Yes.
Well, there's so much more I want to learn about Dispatch
Absolutely.
Health. You hear the music. We're down one segment. We
Oh.
got 3 more to go.
Yay.
I encourage our listeners to stick around. I have got Rebecca Rocco. She is the market director for Dispatch Health here in the studios. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And I'm your host, Bob Roth. And if you are just tuning in, I've got Rebecca Rocco from Dispatch Health. She is the market director here in Arizona. And we are talking about this incredible company that was born about 5 years ago, been here in the marketplace for about the last 3 years, and really does phenomenal work in our community, providing medical assistance directly to people's homes. And I just learned it's not just older adults. It's
It's ages 3 months and above.
and it's not somebody that would want like a concierge visiting physician.
No.
This is purely for emergent.
Well, it's urgent to emergent care. So this is how it works. There's 3 ways you can access care. You can use our website. We have a mobile app, and the most common way is our care request line. So someone can call in and make a care request, and they're going through what we call risk stratification. So they're having a conversation with a care ambassador on the other end of the phone, and we're going to talk about the chief complaint, like what's going on with them. And so as we move through this conversation, our care team is looking at a proprietary platform built by an ER physician, right? So
Wow.
what it does, digging into this chief complaint, they're having a conversation about what's going on, because we want to remove any of those things that may be life-threatening, time-sensitive, right? We want to make sure that this is an appropriate visit for our teams. And so it's going to come out one of 3 ways. If it comes out green, we know we can go ahead and schedule a time and see the patient, usually same day. If it comes out yellow, we want to dig a little bit deeper into that chief complaint.
What would
chest pain, stroke-like symptoms,
Okay.
anything that would tell us that this is quite possibly time-sensitive or life-threatening.
Got it.
Something that sits on the cusp. We're going to go back and we're going to either screen that through an advanced practitioner or an ER doctor. And then if it comes out red, we're simply going to say, please go to your closest emergency department. We don't transport.
Right.
We don't do that. But yeah. So typically we're on scene. We're an on-demand service, and people want absolutes. And I'd like to tell them we'll absolutely be there in an hour, but it's just not realistic. Every day is different. So
especially when you average about 50 minutes with somebody.
Yeah, so we're typically about 2 to 3 hours, same day, usually same day. So it's not something where primary care where you make an appointment with us. Most certainly you could do that for a COVID test, but for something urgent, we're going to try to see you same day.
So you're the market manager for Arizona or Phoenix?
I'm the market director for Arizona, and we will be expanding. We're moving down into Tucson in 2021.
So right now it's primarily Maricopa County?
It's Maricopa County, a few little pieces of Pinal. So we've just opened, and actually our website, dispatchhealth.com.
Yes, thank you.
/locations. That's the best place to see our service area in real time. So you can just plug in your zip code.
Whoa.
Yeah. So it'll actually give you an option to print that out as well. But
You're in all these places?
Yeah. So, you mean nationally? Or?
Yeah.
Oh, yes. We have 30 markets across the United States.
That's
in
incredible.
5 years. It's pretty admirable.
Wow.
Yeah, it's quite, the growth has been phenomenal. We have a lot of partners, health system partners across the United States, Multicare, Bon Secours, Optum.
And I'm looking at the map, and
Yes.
it's all in purple, and it really does cover
Right. So
Pinal and Maricopa County.
So we are. It's a little deceiving because we don't go up to New River. However, I just did open Anthem, Queen Creek, Carefree, Cave Creek. So we're all the way to Sun City West, Sun City Grand. Yeah, it's pretty.
Wow, that
pretty
is
amazing.
impressive.
Yes,
and I like how interactive it is. So, just if you're able to share, how many of these dispatch cars do you have out there?
So we
with
have
two people?
8. We have 8 vehicles here in Phoenix.
Wow,
So we have 4 that dispatch east and 4 that dispatch west.
incredible.
Some markets, like our Las Vegas market, has 15 cars. Denver has 20.
Whoa.
So it's all at the pace of growth.
Demand.
Yes. Mm-hmm.
And, you know, I can give our listeners and you a testimonial, and that is
Good.
I serve on the Governor's Advisory Council on Aging, and I have a good friend, and I won't mention his name, but he's 90 years old, and friends with him as a result of this. And in mid to late March, he was the first person I knew that got COVID. And he didn't know what to do, and my agency was not set up to provide care, and I told him that he should contact Dispatch Health. And you talked about testing.
Yes.
COVID came in, or should I say Dispatch came in, did COVID testing for him. I asked him afterwards the experience, and he said the experience with Dispatch was amazing because he had him come out twice. And I asked him, I said, what was the hardest thing? And again, none of us knew about COVID. We had no idea what we were dealing with. And I said to him, what was the hardest thing about getting through it? Because he was pretty much already through it by the time we had conversation, because I was talking with his wife when I made the recommendation for Dispatch. And he said the hardest thing was when he found out he tested positive for COVID.
Yes.
He said, I had heard all the information coming out of Kirkland, Washington, that old people were dying. I'm 90 years old, and I'm like, oh my God, I'm going to die. And fortunately, he did not.
Yes, well, very fortunately.
And he was scared to death to go
Yes,
to the hospital,
of course.
because he figured if he was going to the hospital, he's not going to be able to see anybody. And Dispatch Health came to the rescue and really helped him.
Oh, thank you for that. That's so wonderful. And, that brings a point up for me. And, what we noticed with a lot of our seniors, they were so frightened and so isolated. So, Michonne Jablonski, who
Yes.
is our community engagement manager, helped to put together a food pantry. We now have 2 food pantries, east and west, and our teams actually take bags of staples with them on the vehicle. So if they encounter someone who, and we're moving into the fall, so this may become more relevant, but if they encounter someone who hasn't been able to get out, or they encounter food insecurity, they'll leave behind that bag of staples for them. So
Toilet paper too.
Well,
imagine early on.
Yes, toilet
paper towels.
just staples like pasta, peanut butter, things that wouldn't spoil, right? So, and they were very grateful. So we did a lot of media around that. It was just, and people naturally assumed we were doing grocery delivery. It was pretty funny, but it was just a service for us and for the most vulnerable.
Wow, I'm looking at the site, and again, dispatchhealth.com, real easy to spell and to remember.
Right. So we do a lot of our own technology. So we like to say that we're also a technology company. Our mobile app, it looks kind of like Lyft and Uber. You can see the vehicle as it moves around.
No
so
way.
Yeah, it's pretty interesting.
That is really cool.
They're pretty cool guys up there in Denver.
and 17,767 care visits last month.
Yes.
That's incredible.
It is. And I really, the growth that we have seen here in Maricopa County, we have such a broad geography, number one, but just the growth that we've seen is just tremendous because we don't advertise. We don't do billboards. We've done a few small television commercials, but we don't typically advertise. We're grassroots, boots on the ground, right? Out really a lot in our senior communities, out educating, being of service to them.
Wow. I mean, it's fascinating what you guys are doing. One question that comes to mind is, we are an Altex provider. Are you working with Altex at all? Mm-hmm. And you visited with them, and are you contracted with the plans?
Well, we're contracted with all plans. So we see Medicare, Medicaid, commercial plans. So
nice.
we're fully contracted throughout the valley. So, access is not a problem. Medicaid is not a problem. Direct Medicare, Medicare Advantage, we're fully contracted. And that is just as of September 15th, we signed our last major contract, which was our Cigna contract.
Nice.
Yes.
Well, and that takes so much pressure off of people
It
because a
does.
lot of people that come to do visits are all cash.
Right. Well, this is typically the cost of an urgent care copay. So we are going to bill you for that visit. We're going to capture all of that information up
so
front.
It could be $30, $50.
It could be $30.
Yeah.
And most typically for Medicare Advantage, that's exactly how much it is, depending on your plan.
That's fascinating.
Yes.
Wow. I am just...
It's kind of cool, actually.
Well, it is really cool. And now I understand why Michonne was just so gung-ho when she came aboard. And
well, we couldn't have done it without her. She's amazing.
Well, she is. And I'm looking through the website, and I'm just fascinating about the stuff that you guys are doing.
It is. And to be on I've spent many days on a vehicle with a provider. And, they're typically working 10-hour shifts. So it's just so fascinating, just the level of care that they're able to provide in that environment. It really is fascinating. So we can stitch, staple, and glue. They can sew someone up. They can stabilize a minor fracture. They can treat a UTI. We have a migraine protocol. We do point of care testing. We have a moderately complex CLIA certified lab.
Wow.
On board. Yes. And we carry a small formulary so we could administer first dose of medication. We carry a 12-lead EKG, so our clinical capabilities are really broad.
And you can also, I would imagine, utilize some external services to do diagnostic testing and stuff like that, and do all that in the home.
Yep.
Like
Absolutely.
X-rays and stuff like that. Well, it's hard to believe we're down our first half.
Wow.
Got another half to go. I want to learn a little bit more about Rebecca Rocco when we come back.
Great.
Stick
not
around.
As exciting as this
Stick around. You listen to Health Futures. We'll be right back.
Being in control of your money provides freedom. Learn how to make it, spend it, and invest it. We're Money Radio 1510 and 105.3 FM.
If you can get a signal on your smartphone, then you can listen live to Money Radio. Download our app for free and never miss a moment of the great advice.
This is Aaron Warby, owner of Online Trading Academy here in Arizona. Right now, we're seeing stock market highs in the face of economic lows. Election cycles are notorious for causing instability in the stock market. That's why we just finished developing our newest complimentary workshop, Protection from the Election. This 3-hour class will explore the strategies professional traders use to protect themselves against market downturns while allowing them to also profit from surging markets. Take control of your portfolio in these uncertain times. Register for this powerful workshop offered in Scottsdale, Chandler, and Peoria by calling 844-877-2337 or by texting the letters OTA to 31996. Space is limited and all COVID safety measures will be followed. Again, that is 844-877-2337 or text OTA to 31996.
How do you create certainty with your money in uncertain times? Hi, I'm Ferenc, host of the Your Personal Bank Show. In this low interest rate environment, most financial tools are generating extremely low returns. There still are options, including Your Personal Bank, that offer a solid, consistent rate of return regardless of what the markets do. Let's have a conversation. Contact me at yourpersonalbank.com or tune in to the Your Personal Bank Show Tuesdays at noon on Money Radio 1510 AM or 105.3 FM.
Want to sell your home without the inconvenience and health risk of strangers traipsing in and out all day? This is Greg Hagan. At 72 Sold, we developed a program to sell your home in just 72 hours at 100% full market value. You can set your own close date, and you can do it without a bunch of physical showings. You no longer have to sell the traditional way. Just put in your address and get a price. Our price, a higher price for your home at 72sold.com. That's right. Get a higher price for your home at 72sold.com.
I'm Jim Chesko with Your Money Now. Investors in Boston Beer are toasting the company's third quarter results, earnings that crushed analysts' expectations, and revenue that was up 30% year over year amid strong sales of both Truly Hard Seltzer and Twisted Tea. The beverage company, which also brews Sam Adams beer, issued a surprisingly positive full-year earnings outlook as well. In response, Boston Beer shares are surging 17%. Otherwise, stocks are narrowly mixed here in the final hour of the session. The Dow Industrial's down 37 points. The Nasdaq Composite, though, up 16. The S&P 500 ahead by 8. The pandemic is causing shortages of drug supplies in the U.S., according to a report from the University of Minnesota. The report says shortages have limited 29 of 40 drugs critical for treating COVID-19 patients, including propofol, fentanyl, azithromycin, and morphine. The report says another 67 out of 157 critical acute drugs, including phenobarbital and lidocaine, are in short supply. That's Your Money Now.
Walgreens has always been there to help make your healthcare easier. From making sure you have the prescriptions you need to answering any questions you have about them. Now, the question is whether you have the right Medicare plan. And we're here to help make that easier too. Walgreens can save you money and peace of mind with copays as low as $0. Visit walgreens.com/Medicare today to see how. Walgreens. We make Medicare easy. $0 copay on Tier 1 generic drugs when enrolled in a plan with Walgreens as a preferred pharmacy.
Listening to this Allstate commercial about savings might be the hardest thing about getting those savings. Save for simply becoming an Allstate customer. Save more for adding DriveWise. And save even more for driving safely. Visit allstate.com or contact your local agent for a quote today. Allstate. Minimum effort, maximum reward.
Not available in every state. New customer savings based on early signing discount. DriveWise is an optional feature. Savings vary based on how you buy. Subject to terms and conditions. Allstate Fire and Casualty Insurance Company and Affiliates.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half here at the Money Radio Studios, right here in the Scottsdale Air Park. I have got Rebecca Rocco. She is the market director here for Dispatch Health. And if you missed our first half, go out to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch this show and many, many more. So, Rebecca, when we broke on the second segment, right before the half, I gave a little tease to our little listeners and said, I'd like to learn a little bit more about you. And yes, this show is about Dispatch Health, but I'm fascinated by Dispatch Health and what you guys have done.
As am I.
And I know you are more of a healthcare veteran, and I'd love to know a little bit about your background and how you got to Dispatch. And are you a native? Are you from here?
I am not. I should say I am. I arrived here when I was about 9.
Okay.
So yeah, we're from Dearborn, Michigan. My father was a Dearborn policeman and ended up becoming a driver for Ford. So they would recruit, when the policemen would leave the police force, they would recruit them to come and drive the Ford executives. So my dad drove for Lee Iacocca for many years. He was his driver. Yes, so my grandfather worked with Henry Ford. So we were a big Ford family.
I would love to have been a fly on the wall.
Oh, he said the
with
things
Lee Iacocca.
the things that went on in those limousines. He actually drove. Robin Williams' dad was a Ford executive, and he drove him many times as well. So he had some great stories.
I'm sure he did. And I know he's since passed. So
he has
I'm
in
so
March.
sorry. Yeah.
Yes, he was. He had lots of children and grandchildren that kept him. But at the start of COVID, our seniors were very isolated. He ended up in the hospital and ended up in a skilled nursing facility. And I think he was so isolated, he just really lived through his family. And at 93, he was like, "I'm ready. I'm ready to go." So.
Well, he lived a full life.
He did. Yes, we made sure he did. So he was very loved.
And grandchildren and great-grandchildren.
Yes, and my
Life
mother is
good.
89, so she's she fell recently, and one of our providers went out to see her, and so she just is a trooper. She's a trooper. Just bless her heart.
Well, and you, where you came here at 9, and you're a healthcare veteran.
Right. So I actually moved to Southern California for a short period of time, and started my career at Pacific Care, which was in the baby days of the HMO. Right. Really, truly the baby days.
I remember Pacific Care.
Right. And then I have twin girls, and they were born there, and I just needed to come home, and so came home and. Worked with Samaritan when it was still the Samaritan hospitals, worked with Samaritan Health Plan, and then Of course, through the healthcare continuum. My most recent experience, I was with CareMore, which is an Anthem company, for 8 years, and worked for them, opened this market locally, and then worked nationally for them. But they had, and what drew me to Dispatch Health is it's very similar to that proactive model that CareMore has. They're no longer here in Maricopa, but they're down in Tucson. So they have a very proactive model that says, why don't we trim somebody's toenails to keep their feet from getting infected so they don't have to have an amputation? I mean, it's genius, right? So it was just that proactive care. They had an exercise program called Nifty After 50 that, was all pneumatic machines designed for seniors as they rehabbed or just to help them keep them fit. So I just, the culture of that model and what it did for our seniors. I was there for 8 years, ended up working in Los Angeles with Cedars-Sinai, and couldn't relocate because of my parents, 89. Well, they were in their 80s and 90s at the time. So ended up working for a very short time with Steward, who purchased the IASIS hospitals.
Right.
And my former GM in Las Vegas from CareMore, I reached out to him and said, hey, what's going on at that crazy Dispatch Health? He's like, you're not going to believe it. So they had just opened up the market director position for Phoenix, and it was just a wonderful decision. It's been just crazy. Because, if you think about
everything, isn't it?
Yeah. And we are, I do everything. I manage our fleet. I manage our offices. My office coordinator reports to me. So we manage all of our medical supplies, all of our PPE, everything that comes in that has anything to do or relates to supporting our providers. We manage all of that. So we have just walls and walls of medical supplies. We have the iStats and EKGs and, just everything that you could imagine. So we have to manage that. And especially PPE. In the beginning of COVID, we'd never used N95 masks, right? So it was something that was, we had to get them somewhere, and they have to be fit tested. So we really couldn't see anyone that had any COVID symptoms until we procured those N95s as a company. So we've got 30 markets across the nation. So we were a little late, but now we've actually developed a supply system, and they're warehousing PPE in Denver. So that's how quickly they moved to solve that problem, which was really unique, actually.
Well, I think all of us were saddled with that.
It was just to see how quickly it impacted everyone.
Mm-hmm.
My medical director is still here in Phoenix, is still a practicing ER physician. So she was on the front line. It was very interesting to hear her account of what was happening in the emergency rooms.
It's just, to me, it's just fascinating. And just the fact that, when you went into this, all of us, we never thought we would be dealing with the pandemic.
No.
And you're taking two healthcare professionals who you said are primarily NPs or PAs.
Yep.
And they're taking an EMT with them.
Right.
I would imagine every one of them, not knowing the situation they're getting into, are donning, PPE.
Yes.
And
so that we are so cognizant of the fact that we need to actually not be a vector as we move from space to space, and we need to keep our team safe. So they're completely donned in N95, gloves, shoe boots, gowns, bouffants, masks over the N95. So yes, we have a full supply of PPE, and so we actually follow very rigorous infection control. So we are wiping out our vehicles, wiping down the kits. So we typically have about 7 medical kits in our vehicle that are grouped by condition. So it's ear, nose, and throat, gastroenterology, orthopedics. We have a lab kit. Like I said, we have a CLIA certified lab on board. So we have all those kits in the vehicle that are accessible to our providers, and they all have to be wiped down and sanitized after every visit. So,
and I think people don't realize what goes into that. And it's not just time, but it's cost, and it's stuff that Dispatch Health, when they created their model 5 years ago, never ever anticipated.
Right. And you really need a certain type of antibacterial to kill, and it's quite expensive. And so we've really managed to keep a good supply of things like Danilite and the things that really kill what needs to be killed,
right?
The bacteria that needs to be killed.
No doubt. And for our listeners, it's hard to really understand how this changes the dynamic of that visit. Because when you're talking about an older adult that's living home alone, which right now it's about 1/3 of our population,
Yep.
and all of a sudden you have two people show up at the door and they look like they're space age,
right?
They're in spacesuits, right?
Yes.
You know, I think of E.T. Remember when they
Yes,
they
I
came
have a
to
picture of myself in full PPE,
Yeah.
and I sent it out to my sister, and she's like, "What is that?" I'm like, "That is full PPE."
But that's what people
Yes.
see when they come into the door.
Right.
Where prior to COVID, it's like, "Hi, how are
Hi,
you,
how
Mrs.
are you?
Abramson?"
Yeah, it's not as personal,
Right.
unfortunately. And, because we spend so long with our patients, that's part of what we do is establish that rapport with them,
Right.
and hopefully help reassure them, right, and help them feel comfortable.
There is so much that you do and we do that is so synergistic
Yes,
and
absolutely.
symbiotic that I definitely want to talk more to you about that after the show, because
Right.
I think
you take over where we end.
Right, and
Yes.
you identify.
Absolutely.
You're able to find those that are needing some additional assistance.
Right.
Because we know 9 out of 10 want to stay home.
Right.
And certainly
yes, they do.
the option of
My
communal
mother is one of them.
yeah, but that option of communal living is
Yes.
not something I want to sign up for
Right.
today.
Right. Yeah.
Well, as you can hear, we had a little AC/DC taking us out. James plays some rocking tunes for us children of the 60s,
I told
70s,
James,
and 80s.
James, you're cool, man.
Yeah, he is. Yeah, he is. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Rebecca Rocco here in the studio. She is the market director for Dispatch Health. Stick around. We got one more segment. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. We're now in our fourth segment, final segment here today, and I've got Dispatch Health in the studio. I've got their market director, Rebecca Rocco, here, and we have
Nobody ever says my name right, so I'm glad. Every time you say it, I'm like, thank you, Bob.
You're welcome.
It's spelled R-O-C-H-O, so people...
Rocho.
Rocho.
No,
But
Rebecca
it's like
Rocco.
Rocco. People think I'm Italian. I
No,
always
but
say, I could be Italian.
But
if
it
you
sounds
want.
so tough,
Yes, thank you. I like it.
Don't mess with Rebecca Rocco.
That's right.
But
Ask my daughters; they would tell you that.
and if you ask my daughters, they'll tell you I'm a pushover.
Yeah, well, no.
All
no.
dads are
Mom is
pushovers.
not a pushover.
But we do share one thing in common.
What?
Rebecca Rocco.
Robert Roth. See,
There
the
you
double
go.
R's. I'm telling you, there's something about that.
Double R's, and we have 3 daughters
Three
each.
daughters. My daughters. People are like, how do you know that? Because I have 3 daughters. That's why I know what I know. They are my biggest inspiration. I learn all the best stuff from my daughters.
Well, likewise, and
Yeah.
and certainly, I, in their eyes, a lot of times are not cool.
Yes.
But I do know some of the cool stuff.
Right.
And
yeah, the phone, the watch, the whole thing. Yeah, they're like, really?
Yeah. and Facebook.
Yeah.
Four or 5
sorry.
years ago, they told me it's no longer cool.
Right. No. And I do things like Instagram just to stalk them. I just want to see what they're up to.
Right.
I want to see where they're at and what they're doing. I don't get on Instagram, but I watch everything they're doing. So.
I hear you.
Yes.
Loud and clear. So if anybody wanted to reach Dispatch
good.
Health,
Let's talk about that.
Let's give out the numbers. Let's tell people how to reach.
Our phone number is 480-493-3444. And what that will do is that should get you into a care ambassador. And remember, we talked about how we go through that preliminary screening. You don't just call us and make an appointment. We want to know whether this is an appropriate visit for us. We are open from 8 a.m. to 10 p.m. 7 days a week, 365 days a year. That includes the holidays. And remember, our services are the cost of an urgent care copay.
And every plan, you're pretty much covered.
We are, but we do have a cash rate of, we have a flat fee of $275. And that's for everything that takes place during that visit. So you're getting an advanced practitioner in your home. So like you said, some things we don't do. We don't provide x-rays. So we partner with both mobile and freestanding radiology providers. And there are things like a mobile lab, things that we can't do. We do partner with CCL, which is a mobile lab. So both CCL and HCI are our mobile providers,
right?
For mobile homebound radiology. And then you really have to be homebound to have a mobile radiology person come into your home.
Well, I'll tell you what, you gave the number.
Right.
Can you call that number 24/7, even though you're 8 to 10 p.m.?
Certainly, you can certainly call, I believe, as early as 6 a.m. So we are not a 24/7 service. And Dr. Prather believes very much so, being an ER physician, that those things that happen in the middle of the night are usually really emergencies, right? So we are 8 a.m. to 10 p.m.
And it's one of the questions you ask, really understanding what someone's needs are. Do you ask questions about COVID symptoms?
Absolutely.
So if you're going
we have a very rigorous screening that we developed around those COVID questions. Absolutely. And that was a really good question, Bob. Thank you for that.
Oh, you're welcome. That
was a good question.
And I'm going to tell you that this is a phenomenal service.
Yeah, it's to be part of something like this, that I think the older you get, and I've spent so much time in healthcare, and there are so many corporate environments, and I tell people I could work anywhere. You could work anywhere, but it means something to be part of something that gives back so much to, we give so much to our patients, and they are truly, truly grateful for the service we provide. And I think about a lot of our seniors who have children that live in other states, and we do a lot of interfacing with children, and they're looking for resources for their parents. They don't know what to do, and just having to maneuver all of that with my dad. And my sister said, what do people do when that don't have somebody that works in healthcare like you do? Or what do? I mean, they're kind of out there looking for resources to help their loved ones. So we were able to provide that. We have a lot of seniors, like you said, living alone.
Right.
A lot of seniors don't have any family, and they don't have any resources. So we try to be that for them.
I'm just fascinating. I thought I knew a lot about you, but I've learned so much more, and I hope our listeners I hope our listeners have as well. So as we get ready to wind down our show, what questions have I not asked?
Well, I think that, I think fundamentally we've hit everything. I just think the future here is we'll end up probably going into Tucson. I know we're moving down into Tucson in January, probably up into Flagstaff. So growing fully into Maricopa County still. There are a few zip codes that we don't service because we have 8 cars. So this Phoenix could probably have 20 cars eventually. Mm-hmm. That's how our geography is so large, right? So I just think that growth is inevitable here, but we just want to be a resource. And like we want to partner in the community and create that team for our patients.
You talk about Maricopa County, and some of us watched that debate last night, and we won't talk about the debate, but prior to the debate, I was watching NBC, and I didn't realize it, but NBC was saying that Maricopa County is like the largest suburb in the entire country.
And it's so
and
funny.
I'm like, I live here. I didn't know. I mean,
so we try to. It's very interesting. We were the first market to expand from our Denver hub, and they expanded to Phoenix specifically for the senior living market.
Sure.
And found Michon, which was like the diamond, but I do not think they realized how broad our geography was. So consequently, we have 2 offices. Most of our markets only have 1, but we needed 2 to be able to dispatch further out.
9,228 square miles.
I know. Yeah, we like to talk about that.
It's incredible. I mean, you can drive over 60 miles from one end to the other.
It's just crazy.
It really is.
And it's hard to fathom unless you get in the car and you drive it.
Well, I will say this, Rebecca, you and I have not had a chance to physically meet before. We talked on the phone.
We did.
And I'm going to tell you, the passion just oozes out of you. You must really love what you're doing right now.
I really do. And it's so important the older you get to to really have a passion for what you do. I'm very lucky.
No, I get it. And listen, the work that you guys are doing for so many in our community, Dispatch Health.
Thank you.
Go out to dispatchhealth.com or call 480-493-3444. Got anything fun planned for the weekend?
I'm taking my mother to the movies.
Well, good for you.
Yeah, the movies are probably the cleanest they have ever been. So she's very excited about that. She's 89.
89 years old.
89 years young. Don't tell her she's old.
And how's she doing?
She's doing great.
You said she had taken a fall.
She had taken a fall. Our providers, she loves our providers. She always wants to see the same provider. I told her that's not possible, but we'll try that, right? So, yeah, she did have a little emergency scare when she had to go to the emergency room, and so she loves our provider, Misty, and she said, "Can't you just send Misty over?" And I said, "No, you probably need to go to the ER, but I just think Misty needs to come over." "No, you need to go." So she ended up in the hospital for a few days. She had some problems with her potassium levels, but she's 89.
89 and living alone.
And she swims every day, and she's a little powerhouse. Yes, she is.
Well, listen, it sounds like the apple doesn't fall far from the tree.
I hope I can be like her.
well, there you go. Well, listen, great having you here on the show.
Thank you.
And keep up the great work.
I will.
Tucson's next, January.
Tucson's next in January, yes.
And then Flag
probably I'm
2022.
Probably 2022. Yeah.
Well, fantastic. Great having you on the show, Rebecca.
Thanks for having me.
Make it a great day. Have a
too.
great weekend. We will be back next Friday.
Thanks, Bob.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3